Today we are gathered here with the party of Agrieve All Nagaland Pharmacy Association. Before we begin further, I would like to introduce this my friend to you all. This is on my right, Lima, the General Secretary of the All Nagaland Pharmacy Association. Puluta, President of Kohima District Pharmacy Association. Tolibo, the Treasurer, Kohima Pharmacy Association. Sister Sikosa, the Assistant Gist of Kohima Pharmacy Association. On my left, Hyacinth, the President of the Parent District Pharmacy Association. And Michael, the Secretary of the Parent District.
Now, we all know that in February 2025, the issue of closure of pharmacies without pharmacists came to the fore and caught widespread media coverage and scrutiny. There were many instances where the pharmacy community was demonized. We were even portrayed as running our pharmacies illegally, which is not factual. In fact, we are also a victim of the corrupt system. The general public as well as our media was made to consume only one side of the story. ANPA could have, but chose not to react at that point of time. That is during February-March. Instead, we decided to have an in-depth study of the ground reality as well as the implications of the department's action on the overall health sector of our state. Now, I want to stress on this because in the tussle between the department and the pharmacy community, it will be the general public that will suffer. That is the point I want to stress. Now, at the present point of time, ANPA has done our bit. We have called this press conference so as to provide facts and figures and our side of the story for public consumption and cognizance by the Department of Health and Family Welfare as well as the Government of India. Now, I have said that we are also a victim of the corrupt system. Now, why I'm saying this is the point. Now, how the pharmacies are run in Nagaland? How are the pharmacies run in Nagaland? Because it is not a vegetable shop. It's not a vegetable shop, so we cannot just blindly open a pharmacy. There are certain systems we have to follow. Now, the procedure that is in the system that is being followed by the department is our pharmacy licenses are issued by the Health and Family Welfare Department, wherein they provided the name of the registered pharmacist and their registration number. We were asked to pay a certain amount for the license, which each licensee has paid. Then the licenses were renewed after every 5 years. Renewal fees are charged from each licensee. This process has continued till the early part of 2024. Now, মই এতে কিবা এটা ক'বলৈ মন আছে মই এতে লাইসেন্স এটা শিকাই দিব এইটো লাইসেন্সতে আপুনি ভিডিও বাৰ কভাৰ কৰিব মন চালে দিবি that will be very good ইয়াতে ডিপাৰ্টমেন্ট বা দিয়াটো হলে SR Chaudhary is a pharmacist person qualified in charge to look after this pharmacy. His registration number is 334. Now, system to kina thakise bole do we are laymen. One layman ase. Aru moen ba jania daktu ile Department of Health and Family Welfare ba moenge edo pharmacy license to di wena mon jani luise. So what we did is when application likhina jana department ge we asked for a license, a pharmacy license. Moen jana edo dise department bar ki korise taien bar edo ready kori dise aru after a few days all of tin bichide avni la license to ready hoiside lo ule ina hoise acha wana moen jaise jaina moen license utha dende license la fee doile iman hobo de ina hoise moen edo di dise. Now, department bra moen ide jani ase de moen ide jani ase The actual system is when apply rather than when assault when pharmacist last certificate luena jawo lage. Department never asked us for that certificate. Holi then nami likhina disido to moen to bhabise maybe the department assigns someone to look after our pharmacies. To moen to itu follow guse. Ina ona moen pharmacy to run Greek organize. That is the reason why I'm saying that our business is not illegal. We have been running our pharmacies legally run Greek. The other point I want to stress is, Aunian media general public department is claiming that since 2020 ba itulan notice to tia suru usi. Holibi Moen pharmacy community land knowledge tidule, the first notification we got was in September of 2021. 2021. Yade, I want everyone to think about this. I have a retention certificate in my hand. This is the retention certificate of a certain pharmacy that is provided by the department. Now, itola retention certificate it was given in 2023, and this license is valid till December of 2028. To department 2021, 2020 ba itola pharmacy pon gole pharmacist to mandatory hobo when aten janina do. Why did they issue it? It retention certificate as there. They issued new pharmacy licenses even in 2024. Now, how is the department functioning? Ito the big question that is the reason why we are saying we are a victim of the system. We are a victim of the system. Ito ikta. The other point I want to stress is Department of Health and Family Welfare started issuing orders to the pharmacies to appoint a registered pharmacist in the later part of 2021. Pharmacists in Nagaland took cognizance of the order and hence pharmacy union was formed in each district and efforts were made to appoint registered pharmacists, and at the same time representations were submitted to the department citing the difficulties faced by the pharmacists due to the shortage of qualified pharmacists and appealing for extension of time. When get 2 months, 3 months in a department extension to elect. Of course, that part we acknowledge. But when the department started implementing the policy with earnestness, the need for a state level association was felt necessary, and hence All Nagaland Pharmacy Association was formed on the 13th of March 2025. Yade ekta when clarify grole munjado itula issue nula raktuile Nagaland pharmacies kan affairs kan doile Nagaland Medical Dealers Association bra so side heije. But when this issue came to the fore, when NMDA give one approach kurise, but then initiative to we were not satisfied. They didn't even call for a single consultative meeting of the other districts. So what happened was that the issue was going on. The closure of pharmacy was at hand. So what we decided was that we have to stand on our own. Itula understanding bra on the initiative of Kohima Pharmacy Union when state kangi mati luise inauna Nagaland All Nagaland Pharmacy Association do 13 March 2025 the form gurise. Still now Dimapur Chimogatima aro Newland dule NMDA bai rukhai na ase. They are unable to join us. But we want to send this message to the NMDA that we have no differences with NMDA. Our goal is the same. So that is the reason why we appeal to NMDA that it will be much, much better for all the pharmacy community if we can work together. When it will message we portray munazi. Now NMDA form gura bichide when NMDA ba kam gura kunuba inazi. NMDA as a first step approached the department and submitted a representation to the principal director and the controlling and licensing authority praying for a reasonable extension of time, but the answer we got was negative. Therefore, we decided to approach both the department as well as the government. We therefore submitted another representation to the Commissioner and Secretary, Health and Family Welfare, but again, the response was negative. Then we have submitted a representation to our Honorable Chief Minister of Nagaland, and the response is still awaited. We have also approached our Honorable Minister Health and Family Welfare, but we were denied appointment. We therefore send a representation to the stenographer to our Honorable Minister. Moen Pabishe Health and Family Welfare Law Minister to since he represents the whole Nagaland, we thought that he will be the right person to approach. Ito ang moen tayong man approach ko ulit try guche. He is reluctant to give us appointment. Even his senior BS is reluctant to meet us. Maybe they are too occupied with some other works. We do not know. But I think we expect our concerned minister to at least meet us and hear our grievances, whatever be the outcome. We have also been trying to meet our chief secretary, but is yet to get an appointment. Chief secretary भी मोहन बिशी बार लोग पौले try गुरे आजे, पौले भी appointment नेटिगिना आजे. Now, at the same time, when itu kurehi nuena representation kani dia nuena on an individual capacity as well as organizational capacity, when pharmacists to appoint globally try guyaze. When action ke motop kurena appoint globally try guyaze. But the fact is Nagaland does not have pharmacists. Nagaland does not have pharmacists. I will come to that point later on in more detail. Holibi moen achidak TV moen season successfully employed gona aside moen achidak TV. We are putting in our efforts. Now the department at some point of time has claimed that we never took cognizance of their notice. No, we have taken it very seriously. That is the reason why organizations were formed, and we are putting in efforts. Holibi subji na thaya na mansun na pakay na mansun lode bat khabi bole to ito to pishi problem dangor hua nisina ho jise moen la problem do. We don't have qualified pharmacists in our state. Enough pinoko. We don't have qualified pharmacists in our state. So itulah situation ekta din moen they are forcing us to employ a registered pharmacist at any cost. Now how do we go about? Are we ready when point itabi stress kuli munjadule? If the department can, think about the matter seriously, and since we are also stakeholders, if they can invite us, maybe together we can come up with a workable solution. That is also an appeal to the Department of Health and Family Welfare. Now, the other point I want to stress upon is ANPA fully understands the requirements mandated by law, and we are willing to abide by it. When pharmacists narakibo guanuide, now only we are coming to know that mandatory as a pharmacist to rakibo lage. Well, we want to employ the pharmacists, but give us some solutions. That is what we are asking. The department. Now, this is also very important. See, Nagaland being the only state in India without a pharmacy institute is faced with acute shortage of qualified pharmacists. India being a developed country with inadequate manpower to mitigate the shortfall of qualified pharmacists has even introduced diploma and pharmacy courses but still cannot produce enough pharmacists. Moreover, no state in India has thus far successfully implemented this policy. In fact, according to our controlling and licensing authority, Nagaland is the first state trying to implement this policy. Now, yadi ekta khuta aje. Nagaland even union directories to be soap the pharmacy institute aje. Nagaland is the only state in India which doesn't have even a single pharmacy institute. And even the Nagaland government is unable to send adequate number of students to study pharmacy courses on government quota. Now, what is their plan of action? how do they mitigate the problem? Because they know very well that there's a problem. But we don't see any efforts on the part of the department as well as the government of Nagaland to mitigate this problem. Sabi, advanced countries can, European countries can kikian dito diploma in pharmacy no loy de. Tan la minimum qualification to ile bachelor's in pharmacy aje. Holi India dito manpower nai do. India is still a developing country. We don't have enough manpower. Itu ba tan pharmacy diploma in pharmacy course be introduced kodise. But still shortfall do ile bishi aje. Other states, ajikali to Google gosi gole sob pachani lo. Alag states kan de saisi gole to Andhra Pradesh, Maharashtra and ladi saisi 50, 60 institutes. There are 50, 60 institutes in those states. How many pharmacies are they producing each year? Nagaland is the only state without a pharmacy institute. To government la plan of action to be kiya. Our still other states can man pharmacy institute thagili then itula policy to implement go na parnas de. No state has successfully implemented this policy. In fact, in some states, the matter has been litigated. It is under litigation. So, Nagaland to itulay condition ekta de asigusi gulido, our controlling and licensing authority has proudly told us that Nagaland is the first state to try to implement this policy. Are we in a position to implement this policy? I think it's a big question that the public deserves an answer. Public deserves an answer to this. Now, if you look at the ground reality based on various data, the ratio of pharmacists in Nagaland to the number of pharmacies in Nagaland to the number of registered pharmacies is quite disproportionate. As per the data provided by the department and published by the Nagaland Post on the 14th of February 2025, there are 1,157 pharmacies in Nagaland. Ito pharmacy khuli na thani aside. License lui na pharmacy no khulian do kiman 1,000 hobo ito do when kuhona paro. Ito do data collect kursi bole do. I don't think it will be a small number. Whereas there are only 278 registered pharmacies according to the Department of Health and Family Welfare. Now, let's work it out. Tayo ba Nagaland Post di kuha isap dito, aro Nagaland Post di publish kuha isap dito, 1,157 operational pharmacies in Nagaland. Whereas tayo ba data provide kuha dole 278 registered pharmacies in Nagaland. Out of 278, 252 the government employees are there. So government employees cannot run a pharmacy. So let's put them out of the picture. Now how much are we left? We have 26 pharmacies left in Nagaland to look after 1,157 pharmacies. Ito ikta ase. When la grievances be ito ase. The other point, I think this is very important. Impact of the policy on the public health sector. ANPA, after thorough analysis of the ground realities of the view that if the government is to implement this policy in its entirety, will put the public health sector in complete disarray. Here are some data in support of our views and for the consumption of both the general public as well as the department. Even in Kohima, the state capital, some colonies like AG, Merilita, Leary, etc. will be left without a single pharmacy. Pabi sayo mo ang Kohima la wezide. Our AG colony do largest colony in Kohima. Government ba pharmacy sok to shutdown gori si goli do. Leary di do ekta pharmacy bi napachibo, Merilita di bi ekta pharmacy bi napachibo, AG colony di bi ekta pharmacy bi napachibo. तो इत्या stop एक 18 rupees for किनियोले colonial pharmacy di kini था दो. The nearest place they can go is Pier Hill. Just think of the inconveniences caused to the public. Our rati bimar ekta hosi kiba ekta hosi ule even basic medicines भी दिवो ना पारुले. Even a simple headache, probably manu muri jay. Holy suddenly rati di bimar hoise goli to kut par lobo. Morning no hada isorge morom ramugi morning dak no morai di de wena ru khaibo na ge. Ito last situation ikta de ase. That is about Kohima. Let's look at the data of some districts. Melori, Shamadur, Peg. Melori di presently 6 pharmacies ase. Pharmacy choita ase. Tade ekta bhi registered pharmacist nai. Shamadur de 4ta pharmacy ase. Ekta bhi registered pharmacist nai. Peg district de 34 pharmacies ase. Tade 2ta in-service pharmacies ase. So in-service pharmacists can do license to cancel go lage. So just think about this. Melori, Shamadur, Peg can do whole district without a single pharmacy run guru. Public la health to kila position ekta de rakhi dibo. So ito district headquarter and liaise. Now think about the subdivisions and rural areas. There will be complete chaos. There will be complete chaos. Now we want to ask the department, the wider question is the department in a position to fill the vacuum? Time pharmacy so bon godubo. To time la policy to ki ase. We are going to close down all the pharmacies, and in the meantime we are going to do this so that the public doesn't suffer. Time itu la point of action ekta bhi ase na nahi. Time la concrete policy ekta bhi ase na nahi. I don't think so. Now, another point we wish to stress upon is that there is no case in Nagaland where a patient's life was either lost or put in jeopardy because of wrong medications administered by any pharmacy. In fact, everyone must refresh our memory and think of the services provided by the pharmacists during the recent pandemic, that is, COVID-19 pandemic, when the department or the government was in no position to even provide basic medicines to the general public. Now, at that point of time, the burden and responsibility was borne by the same pharmacies that the government and the department is trying to shut down. Ito to one so public, general public bhi hogi, kun bravi nohi go na parbo. COVID-19 to kila situation thai je. Pharmacy and thakya nai kuti jawa thai je. Was the government even in a position to provide even basic medicines? No. What if another pandemic comes? Transition to smooth ho lage do. Transition has to be smooth. There must be a solution. There must be a solution. Of course, we are not saying that the policy is bad. Nagaland has to move forward. Nagaland has to move forward. So, of course, changes has to be brought about. But these kind of drastic decisions will put a huge vacuum in the public health sector. That is what we are observing. Now, the other point is, health is a state subject as per the constitutional provisions, meaning any state can frame health policies that is relevant and applicable to their state. Then the question is the government of Nagaland and the Department of Health and Family Welfare Department equipped adequately to step in and fill the void? Now, I want to ask the department, do we even have a Nagaland-specific health policy? If there is, make it known to the public. But I think the answer is a big no. Our government is unable even to appoint qualified pharmacists in all the government-run health units. Now, I want to provide some data here. Public health units. Government-run public health units, TV department pharmacists, sufficient pharmacists appoint go na parinas de. Mon district ekbar sawo. Sub district na najawo holi moi kunuba district la data di dibo. Mon district is Shangniu, Oting, Wanjing, Angbang, Mopong, Yongkao, DDC Mon. Ito ang the government registered pharmacists appoint go na parinas de. Peg district ewo. Semo Peg, Chief Medical Officer Peg TBA, only 2 pharmacies are there, whereas the sanctioned post is 3. Tadi pisa choto techome khuzame pharmacist nai. Public health units to kulise olivi pharmacist appoint gorna. Melori di ek par sawa. 4 lepore baziho akiko sitze hutze pharmacist nai. So if the government, if even the government is unable to appoint adequate number of registered pharmacies, time the solution to ki diya je. So in the meantime, what the government is doing is to solve the problem. What the department does is to impart a 3 months training to the nurses, and now the nurses are dispensing medicines to the patients. Should the same yardstick not be applied to both the pharmacies as well as the government-run public health units? To time na public health units the pharmacists appoint group na pare aba 3 months training course di na nurses can get medicine di wole dia siguli do. They are not registered pharmacists. Should the same yardstick not be followed to both the pharmacies as well as to the public health units? Time be the pharmacist na thakya ba appoint group na pare na sinagi. To tardo appoint guru na pare aru moi kita job por justi apuni ando kut probably appoint guru lage. Itu ekta asile. Now ANPA is of the opinion that the department can come up with such programs if they have the will and are concerned about the public health. Kung natin certain policy, state-specific policy kuno frame guru na. In the meantime, when shortage of pharmacists face to ekta certain policy implement guru na. Let the transition be smooth. Now, in conclusion, ANPA is not against the department or the policy in question, but we are of the opinion that Nagaland is not equipped to implement this health policy at the present point of time. We are hopeful that the department would come up with some workable arrangements till such time our state will have pharmacy institutes and sufficient qualified manpower to provide healthcare to the general public unhindered. In the meantime, we appeal to the department as well as the government to allow us to operate our pharmacies till such time the department comes up with a concrete health policy that is relevant to our state and that the public health care is not left in a vacuum. We assure that on our part, all our efforts, both individually and on an organizational capacity, shall be made to employ a qualified registered pharmacist. So, when in conclusion, when last day we appeal gole monase, when we try nugranwe, we have done our best. We are trying our best, and we shall put in extra efforts in the days to come. But we want both the general public as well as the Department of Health and Family Welfare as well as the government of Nagaland to look into the matter seriously. And come up with a workable solution for the interim period till such time when we have enough pharmacies to take the mantle. So that the transition will be smooth, the public will not suffer, and everyone, irrespective of whether someone lives in the cities, towns, or rural areas, will get at least basic medical service. That is what we appeal to our department. Now, thank you to our media fraternity for your patient hearing. Now I'll open the time for Q&A.
That the government is unable to appoint qualified pharmacists.
Yeah.
And you have also stated that there is a lack of qualified pharmacists.
Yeah.
So what could be the reason behind it? Is there a lack of interest or some other reasons that we don't have qualified pharmacists?
No. That is the reason why I've provided some figures also. See, first thing is our state needs institutes. to produce enough pharmacists. Our state needs enough pharmacists. Now, institute থাকিব লাগে তো institute the pharmacist qualified pharmacist can do pass out কৰিব লাগে তো না হয় না নহয় হলি state the একটা institute পি নাই pharmacist institute government bra at the most they can send is each year state la kota di 5 জন 6 জন ki pharmacy la courses puribole khota ase to na so every year government, let's say that every year government is producing 5-10 pharmacists. Will be at the same time, itia pharmacists thakian to be retire be hoye ase muri ase to. So number is not increasing. It was a problem though. Pharmacists nai. We have inadequate qualified registered pharmacists. That is the main problem. It's not that we don't want to employ. We want to employ. We want to save our business. Because this is not just business. Okay, of course, there might be some rotten apples. Rotten apples can be thakibo the moin la community dibi. We are not denying that. Holy be most of us moin be itula business run grado. It is for our sustenance. Moin itu why family survive create. On top of that, we are also providing service. Moin itu bi ase de. Moin la bhavanabi. This is unlike other business. This is an ethical business. Moin itula thought pukina moin kuri de. Holibi itia doile thousands of families are dislocated. Thousands of families are dislocated.
Just supplement something.
Okay.
There are 1,157 pharmacies in Nagaland.
Yeah.
So according to the data, there are 278 registered pharmacies.
Yeah.
Where 252 are government employees.
Yes.
So 26 pharmacies are naming these 1,157 pharmacies. So what I want to know is how currently how are you operating the pharmacies? Are you providing training to those manning the pharmacies or how is it?
No.
Okay. Just to supplement my friend, what I want to know is, since you are saying that there are no qualified pharmacies,
Yeah.
no, but so how are the pharmacies being run? So without a qualified pharmacies,
Yeah.
so how are these being running? So how are they providing the medicines to people?
Actually, ina ase. Moin kwa nisina Nagaland de first place by department by edu strictly implement korna aishi wele do no pharmacy would have been running without a registered pharmacist. Moi kwa nisina department by edu license ready-made license disi do moi ge. Na, of course we were ignorant of the law. We admit that part. And ignorance is not an excuse. We also accept that. That was the system. That was the system. Because Nagaland de pharmacist na thakya right and pharmacy license to dian wena ta tribunal la bi gushina Nagaland DV ba ekta interview lo adem de controlling and licensing authority ba bi gushe. Tribunal form gorna then based on experiences. 5 years experience, 10 years experience itu an ge tan kiba bi dishe. Pharmacist certificate dishe. They were appointed as pharmacists, as registered pharmacists. Paramedical Institute to be 2 years course introduced course there. It's not diploma, okay? Certain policy in our then it to mitigate grow immediately. They produce a huge number of pharmacists through that course. In our Julina is to government dakpabi itu kurishe. To pharmacists can be run globally though out of question. So presently most of the pharmacies are running without pharmacists. It's either based on experience. Bishuwala do ele ekta pharmacy de buibo. Tadiba experience gain grow, doctor and lodi gain grow. Ina wana self-taught as it. That is how our system is running.
I'm asking too many questions, but one more question.
Okay, no problem. Take your time, please.
In your statement, clearly stated that the government and the department has not solution for this problem. So what is your suggestion for this issue, apart from asking the extension of time?
Nay, ito na, inaigtase. Like you pointed out, we are asking for extension of time na. In the meantime also, we are not just going, when then any representation din with. We sit with them. We try to talk to them. When the time bujugo na gitu labi, when approach kuya. In the meantime, when like expectation be it let's come up, let's sit together. Ikilo buiwo jang na. Let's discuss the matter. Let's discuss the matter in depth. Aro ekta solution ekta ani mo try go jang na. Kili mani sabi. Itya Nagaland de 700, 800, 900 pharmacy pon gurisi golido. Ultimately public is suffer go. Na public is suffer go. Ito ba, yes, we need to move forward. Kwan isina Nagaland bi, buila ina thagise, when buila ba ina thagise, ito la system di thagibo ito noy. We need to move forward. Well, we ekta move forward koruli do government bi, come on, let's sit together. Ekta transition koruli do ekta chalna, ekta solution ekta bisarbo chalna. Na, let the transition be smooth. In the meantime, when we pariadak research pharmacists to employ gurbo. Na, our department rabi, come on, do your best. Bring pharmacy institutes. Ek time when a tuita dinda ajikali to private institutes can be anibo barbo. Anina institute ek time when a jalna alag state can be pit kona pasta chuita animina. Ina ona produce enough pharmacists so that the transition will be smooth. If and when the government comes with such a policy, and if and when the state will have enough pharmacies, we don't need the government to ask us to tell us to close down our shops. We will shut down our shops on our own, voluntarily.
Adding to that, itu pharmacist to shortage ha lagama jodi bi ita do ami khan ki communicate kora do bahar bra itu pharmacist khan anya khan to itu bi bon ho jase ita do ite bi komti nai bi nai inega ho ma jodi ita do apni bahar bra bi pura man bi certificate bi ani kine chulibo na paribo to ami khan ko to bra chulibo ami khan itu kane agide sadi ko ani sina ami khan to gor itu department ke ko bole mon thakya to itu time to aro extend korbi na inega hoisu kole ami khan bi itu time de kinika hole de parebo itu la bi bisaribo do inega bi na hole ami khan bi kinika gurubo ami khan aji tu inega ho jase itu bara aji tu sob ai gini inega ko tha korase de
Majority was not qualified pharmacists. You are just running the pharmacy on an experience that you had from sitting with some doctors or maybe in other some pharmacies. So only to it's time extension money you know that pharmacies at the pharmacy to collaborate doctor is now in many places, no? Because without prescription भी दवाई दिया खान भी असरे because जाइना वहाँ itu aji itu hazo मिले इन्हें pharmacy दे थका मंगवान बाय दवाई itu खाइले बाल हो इन्हें चीज़ें दो so that means you are doing it without the actual qualification you are having just out of experience. So now you are asking for time extension तो आपने यहाँ भी की solution तारे की करो आपने यहाँ इतने because just asking for time extension
bisaribo ami khan
tadi na tadi mo ita point ita stress ko mo na je mo ikan of course when kiba gradually na je when extension of time mangya je it will ita so that we will hunt further na we will hunt for pharmacists decision pai je de achibi kalibi ekjon duijon do ini pai na na ina ona decision pai je de babi aru when department ke approach kurijo sabi itula problem ase there is shortage of pharmacies why not in the meantime abuni chalna ekta come up with certain courses na ekta course ekta kiba ekta introduce kurina onian ina usukule we are even willing to pay for that course na we are even willing to bear the burden. Transition korule do, we are also losing our livelihood. That is also one thing. Of course, that is not the main point we are stressing upon, but point is a solution to bisharwo nimide ekta course can be introduced kurili bi ki jai. One is a department by pharmacist appoint group na pareba 3 months training course di na nurse can get PhD de tawai dibo dia sido. Na, so if the government can come up with such kind of policies for a certain period of time, we are not asking for 20, 30 years, okay? We are not asking for 10, 20 years. But any few years, nimide ekta transition group nimide ina ekta kurina, ina husi do our state will also have enough pharmacies in the meantime. Na, aru moen nimide holibi moen la livelihood ase itia. Itu la business to na. Moen la livelihood pi ase. To husi do moen je olop time disi bole moen bi pharmacist appoint group parle group no hisi bole bi moen bi alak business kan de holibi transition group le na. Transition period to olop extend kori bi na. Itu ko ase moen gwa do le.
One question, you're talking about extension of time.
Yeah.
Right. So, how do you have a limited period, like 5 years, 10 years, any time frame set for the extension?
No, we are not demanding for 3 years, 5 years, or 10 years. But we are appealing to the department to give us a reasonable period of time. Reasonable.
So, what is that reasonable period of time according to your association?
That is what we are saying.
Until such time, the government is ready with the qualified pharmacists. Because I just want to come in here. Pharmacy, how you are running without qualified pharmacy? We also admit that we are running pharmacy without qualified pharmacists. Only necessity is the mother of invention. One is not the needs of the hour, the needs of the time, compel us to choose this profession. This pharmacy is a noble profession. We are not just jump into this profession. Only be looking to expect the needs of the town, the needs of the area, our area. Pharmacy 9. I myself will suffer. So why not we find some solution? Medical field is medical company they can't receive funds. I'm just taking an example. For a few years, then I got experience in medical things, then left that company and back home and started pharmacy. So still now I'm running more than 20 years. I'm running pharmacy. So experience with that. Though I don't have that qualified pharmacist qualified certificate, not a pharmacy holder, certificate holder. Likewise, everyone has their own story. How we come into this pharmacy profession. Itu need based join also it is pharmacy former speaker details explain. We are not just doing a business here. We are also trying to bring some change and try to help to serve the people. Pharmacy business it is something like not like other business. Itu karena they are just compare with other business. Pharmacy business is running with full discipline. Our rules and regulations busy. But they will have to maintain the stocks, temperature, guidelines. We are observing, we are following, we are obeying all the rules and regulations. Issue actually it is not an issue. Yet public here misunderstanding. It is not that we are cooperating with the department also. We are trying to cooperate with the department. Department your pharmacy cannot be run without pharmacists, experienced pharmacy, and qualified pharmacists. So, documents, everything is perfect. The license were issued by the department only. So, among Google, the criminal is not treated. So, we don't have a pharmacist. And we are also trying to bring out, to come with the pharmacists, and we are only bisari. So state among Nagaland state the conditions I see number to ground ready to this I see we don't have a pharmacist, qualified pharmacist. Night Hakatu 278 decades, it probably be one figure part to Pache. So Tagani maximum to the government employed ase na pura 26 saman pa ase 26 it to be to the master in pharmacies doctor in pharmacies kura ase they will go for another job sub pharmacy de boibo pa noi 7-8 lakhs khorcha korna kinia pharmacist to ekta boibole mon ho to itu gare ta mi willingly na to amala state aman bisare na pai to itu pura thik ase edika hole koina aman to state bi aman convince kura ani bole kursa ta I hole mon na bi convince kura I hole kura again the department said will not allow from outside. So where do we go? Indicasi, article to pharmacy is not the only way of survival. To aban bon kuri dibo kule public to suffer kuru. To amoi bon kuri dibo dia tai bon kuri dibo sab bon kuri kule kun suffer kuru ade na te. Sab public suffer kuru. To kile kule itia sabi kini ka upay ta kuri na bi abnyan se kuri kuri ba dinde manu documents lagina pharmacist laga itu degree holder kan D farm certificate to lagina hang kurna ase bande. Only with the person is not going to sit in the pharmacy, all the same. The same person is dealing with the medicine. Only the certificate is hanging in the pharmacy. Is this no? So it will justify group or man. It will no. It will moi ko to moi to interest na itu group. Dahil na moi no hoy ko na, moi na pare ko na, sorry do. Only with itu jai na bisarebo pharmacist, bisareg na alibo, tade hang group. Itu manu ke have to pay another 10, 15 to 20,000 extra for that documents only. Whereas the person is not willing to sit in my pharmacy. Aru ni boabin the boy budai. Idea thagi ese boabi Dimapur chumu itu area sabi. Bisi baktu itu just certificate hanging that the person not there. Idea la context eknia condition. So ground reality saina kam guru lagi. Now department kya moi kole mando they don't have to run corner to corner. They don't have to enforcing this. Itu nakuribi kona libi. Iman dupi guru kam nai. Jadi government para diploma dosra B farm na nohili at least diploma institute nisna ekta state ke anishi kule every year 200 100 200 pass out kuri kule within 2 years diploma course 2 years ase to 2 years te 200 200 ase within 4-5 years te pharmacy se borta ho jabo diploma korina tai khan nije he bisari na jai ai jabo pharmacy de we don't have to go looking for them they themselves come aro pharmacy de occupy kuro to idigala situation na ha tok tu itu एक to fully implement gule aware bit nature thasi mona state la condition to government bi tara weakness to jani bolage khali pharmacy ke blame kurina aro public kan na jane pharmacists kan sab bon kuri dibe itu kan ko kam nai na jana ade boise tu bi kun te at the end of the kun suffer kuro public ke suffer kuro amala district ke dia to college na there are 8 health center community health center ajikali health and welfare center boy 18 districts, 18 sub-centers. Tadibi, they are supposed to be pharmacies. We are not condemning that GNM, Kurikana, Takahan, they are not qualified. They are qualified in their field, but they are not supposed to handle the medicine as per the Act. The medicine dispense group only pharmacy here, so it nurse can be from like BSc nursing, MSc nursing, Takahan. I can qualified as the will be there by the Act. They don't allow. They didn't allow to handle the medicine. It was not. It took the IC group to strictly follow progress of the policy. It took our 20-30 years experience with medicine deal with the Takamuno Kibi. Just shut down Ruby with them. It took prototype no. Will be Sabi, analyze Ruby, authenticate Ruby, Paramanukitu, Ekta situation, Ekta condition. They are run group lagi. So in the hope is there until such time that Amona state itu pharmacies ready bagina institute anina to ready no atok to itu act to fully implement no prile bahala se ekta bridge bangabo thole to alternative age bisare to age bridge bangai dile kina gare jabo alternative route age bisare bina to alternative to rakhi na itu bridge bangai na ten manubi no to itu nisna amana itu fully implement group gole to itu age ekta alternative bisare bina kuri dibodo mani ready astos itu garne ko ase public hangi itu jani bona
kombal laga PSC khande government appointees ase holibi general public khane bohi ase takhan to appointment to ekta alak bohadu manu alak iniga laga bi mohalla evidence ase mohal lokote na government to kitia itu department itu lagi se kole mohan itu khan sob ready ase ami khan takhan lokote ki bishi hudise ami khan department lokote kini ka kurele bal hobo lekha lekhi ami khan lokote bishi ase de itu khan do department ke dise department ke itu khan bi answer mo hange dibi itu kan tu mohan itu kan lagi department para tu tahan la phale bari information dia se tahan dia laga aru kwala tu ala ko jese newspaper de ko je more than 300-400 unemployed pharmacies ase 300 bi puncha no according to department ratio to ami kan tu ko te jabo ite du takan action aibo kiba kibi likhi kine public ke pakala kori dibo itu laga na hoi du ite du bal bara agi de condition na bal bara kuri kine ami kan last state tu forward kurubole laga time hoje itu bara ami kan aji yete thagya du agi de kuse ami kan to department laga against nai de ami kan bi kurubole ase ole bi kine ka bisaribo rasta ami kan ge bi dekabi aru ami kan gi bi mondo kuribi to ale ami kan de department mara mohang na expenditure bear kuribi kwa na hoido rasta kan ami kan ge dekabi to ami kan bi bisarubo kuribo do ole bi kwa ni sinai te du ini ka hoje to ami han ko de jabo imam family du ko de jabo ini ka concern thagya bara aji ami kan ide haiside
Moi ganna udula question de previous question de moi ta answer dibo mun jado na. We are not asking for a specific period of time. Only we are asking for a reasonable extension of time. Moin kile reasonable do koisi boli do moin kwan nisina we are all stakeholders. De moin ki dia pon go disi boli bi that is not the solution. Public suffer go. To moin reasonable solution ekta do moin la opinion didu ina ase. We are all stakeholders. Pharmacy community, department, medical experts. We have medical experts in the field of medicine in Nagaland also. If necessary, invite from outside. In Abiguana, let's sit together, look at the ground reality. Na, what is the reality in our state? Itu ikpar sabo jalna. In our government, come up with a policy. Policy ikta anibi. Sabi, 5 years tak itu moin institute iman kiba kuri dibo, ina kuri dibo. Moin itu solution ani dibo. Ina ikta kuri na ikil ode workout kursi bole the public will not suffer. Transition will be smooth. Our state will also move ahead. Itu aside kota do. Itu noisi bole do itiala do solution noi do. Of course, we'll lose our business. That is also one thing. Let's leave it. Only public to moin Kohima Dimabor kandi thagian do na. Itu iman seriously do na hawi uli bhabi. Only moi itia figures ko nawa dia din nisina sabi do. Melori district ti choita pharmacy thagisi ekta bi pharmacist nai, so all the 6 pharmacies will be closed down. On top of that, public health units TV ko 1 2 3 4 5 6 choita ti do nai. Ar sob village ti do public health units bi nai. To isibole Melori gando ele matha phika isibole chal kari hayo ruwe. Fekti tawa gini bole jabo. Fekti bi pharmacy bacho na na bacho gi jani. To chal na ina nukuribo. Na public bi suffer nukuribo. Ina na solution, permanent solution ekta bisar boli do. I think it's up to the department. And that will be our reasonable period of time. The solution that they come up with. The solution, the roadmap that the department comes up with will be the reasonable period of time for us. As of now, we don't have any such plan of action. We are not going to come out on the streets. We are not going to resort to some violent actions. We are not going to resort to any violent actions. But we want to knock sense into the heads of the department officials as well as the government to face reality. Because Sati Bhagwan Nisina, invention is the mother of needs. Na, according to our needs, we invent. Na, we innovate. To chal na ekta certain period of time in the meantime ekta workable solution ekta workout kuri binagi itu appeal kuri ase we still now we are only appealing.
We are not against the system. We are not against the department for what they are doing. We only request the government or the department to look into to look beyond the words on the paper. Itu aja mandi. Kali paper dikit lagi saya itu implement na kuribo na kuina ground ready design na amanti come project behind us. Just see behind the hearts behind our amanti come guna itu bisa bola. Yes, we don't deny, as my former speaker has said, pharmacy amanti nije brabi amanti accept na bra pharmacy bisa aja because it bring down our reputation. Pharmacy da reputation be turn down grade. Kini kule ABC medicine na ABC bin na kulang lebih aja will be out of 190% pharmacy with purpose, with reason create na tayo right. Tayo lang background sa siya gule baba doctor as nurse, no limit doctor nursing home te kunba niga tayo like my friend his father is doctor. Niga itula legisi doina kulab si baka siya. Aro mana manung bisi bak sa siya gule amoy B farm korna M farm korna will be through my experience amoy sa din dito amoy kiman learn ko it is more it is I think good enough to at least educate people because if I am especially Naga people are very weak in this medical field. One doctorate guna thakilibi, engineer guna thakilibi, I not medicine to engineer ki khai na. Simple. Then we are trying our best to educate them. Aro itia sabi to danger. The danger when we talk about the pharmacy, among pila ko siya, among pra kunda ke ekta medicine wrong medication guna mulai dia ani report na. Kali educate as far as possible we are trying to educate the people from our level. I go itia Nagaland sabi to. Grievances portal. Grievances la prescription loy na ahe nahi. Dukan ki mana hai? Side to ekdam boy lagi amando sai na. Injection, nandrolone, steroid na. Triamcinolone injection every day once daily for 5 days dina anu. Itu medicine no to once in a week hardly it be patient la profile bal pra sai na dibula injection. Grievances pat likina le lamba kora man de de to. To patient ki adina man bal pra ji. Partner kora banu ba likhi dise. Partner brother kurise isor par bal gole dawai na likun. Maniga exhibit kora bisi ba khai. Itu dibido painkiller komor bikhai ase. Ki dibo? Itu dimol dibido na Fensta dibido. Maybe flexion dibido. Itu duita ki lo ase. Duita ki lo khale ba hoi do. Itu duita same medicine ase do. Ini amana ignorance bisi ase amon trying that our best itu medical doctor han pra maybe pharmacist kora kan pra so bosti bolina educate kora I will try our best to educate these people. Sorry. Aru jodi sabo gole kile pharmacy ke sob target kore. Moi to pra koise. Pharmacy business to unless there is a good reason choose no kore. So manura chukul sai do underground ni pharmacy ke target kore. CSO kan be so pharmacy ka letra wala nisna. Whereas bandu para to discipline maintain kore. To for pharmacy business to choose no kore unless there is a good reason. Kile gole aman dosra department kan sai gole Nagaland de easy ase. Dosra without discipline business run kora aro kobo gole danger la pode pharmacy garage la kota bui gari na garage te jaina sabi to kun pra kore mechanical engineer para no kore to ekta ini pole ekta baidi gari banai to luxurious car kore dangerous na ta hanwal ki banai sin na sabo gole building RCC building agida asam bara kiti te hal mari na ida RCC building banai ase amon kiti bin na sa to geotechnical laga kiba survey bi na kore or engineering analysis na kore na itu building kiman story uthabo itu building to dangerous na itu kan field is sabo kole danger la kota kosi to sa department bi bises khali pharmacy to we are trying our best to follow with the rules go with the system khali the problem ase itu problem to pharmacists nai aro itu bi amhan bi trying to cope with this follow cooperate crazy only bi nai to materials nai equipments nai koti pra ani itu is a problem to understand kori bi itu was
Kohima de 141 pharmacy ase dokan iman ase to iman de around 10 to attached to the like a hospital khan iniga thake ase to the rest to iniga ase itu ma jodi tagan du gase ami khan ke tu iniga kurbi ko law is not only for us law also should be applied because according to the law like government kam kora manu di tu kurba na pare whereas Kohima de sale de bishi bak to Kohima laga pharmacist te check kuri sabi itu an government employee da su do to tahan du ko se apni khan tu qualified na ko apni khan tu take na ko ami khan tu criminal nation na to tahan tu ki ase mohan itu bi bujibo na pare itu hora ki karne ami khan ki iniga pura se o itu bi bujibo na pare iniga laga situation de thagi jaise to iniga laga situation de ita to according to this drugs controller laga office te saishukole to June this June to last ho jaise to agide dikha nishina itu letter khan tu validity to 28 tak ase mohan to paisa tu validity tu paisa 28 laga disido komba tu holibi itu khan bi thagilibi dikhilibi ita tu cancellation order to sob logode Kohima de cancellation order pai jaise to inikai koise according to the drugs and cosmetic law apni itia dokan khulile 2 sal jail de jabo ine ho jaise to ami anko to khulibo ita to itu time na ami kan kini ga kurubo ami anko te jabo itu bi hudia je ami khan du so bi akha gura je go itu department du ami khan laka plibi huni gene ekta kiba ekta understanding na higine kurili tu biji balo bola na hole di further course du ami khan bi ki kurubo na jene hole bi ini ka bi hoje gole tu ini kotha bra action ge respect kuri gene action ini ga kuri thagiala itu bi hona kule tu opanai du na ini ga la situation bi aije mo no debi na itu bra ami khan department logo di bi ko bole mon thake tu ini ga na hoy gene ami khan ke check kuran di jina ta han bi government employee kuri gene rang gura khan check kurbi na tan employee kuri gene money substitute kura khan rakhibi na for example meluri employed pharmacies holi bi tai pharmacies buhanai do dosara mane just merely graduate manu buya do ami khan itu khan la figure job district ami khan bisari ase kiman ase kini ka ase fake ase na nai office para paper de issue kura de hosa ase na ami khan tu bi sa ase olibi tu kami tabi tik nai to ami khan ge ko je target tu kali Kohima town Dimapur chumu iniga khane target kure what is to the rest of the district to kiman suffer kure se ami khan tu kham sob sagine itu agide ko ne jina ahigina jama kure gene iniga hole tu na hobo ho jania je Nagaland organization bisi ho jaise ma bi tu du alchi lagi kintu itu compel ami khan ge compel kura bra ami khan iniga hoigine ajia higine ami khan la rights to iniga kwasidi
Earlier you had alleged that the department has been issuing license without asking for certificate. So you mean to say that the department has been randomly issuing pharmacy license to licensees?
No, we'll leave that answer to the department.
takane issue
But-
kure to tange dibo
Ito license as a camera cover guru parle well and good. Well and good.
How much do they charge for registration? May we also know that amount is
Ito
varies from person to person.
Ito-
That's what they give you.
ito ina ase.
uniform.
not uniform
Muy kwa ni sina na.
So there is a backdoor appointment kind of thing.
Yes.
You admit that.
No, it's something like this. Something like this. See. Yeah. Yeah.
Even if you are not a certified pharmacist.
Whether the department resorted to corrupt practice or not, we are not alleging anything. But we'll just leave the answer to the department.
to answer
But this is the fact. Mui itu license apply gura dende application ekta likhise jaina department ke dise department bara odo din dai bidai gise chaise jado dile itu license handover guse yade SR Chowdhury aje tain bara
Qualified for it.
itu qualified person tain brai designate kodise de tain brai di dise
Department,
brai
yes.
dise
Ito optical application they mentioned that.
No. They are only now when it is there. We are supposed to, take the certificate as well as who knows, even the person concerned. Only department from when ye other India say ASR Chowdhury lam namdo hali dise registration number 334 halina dise. Department bra itu dise do. Na.
Why didn't you complain in the first place when you know that it's faulty?
No, that was the system. Okay. And like I said, being layman, okay? Being layman, we are not familiar with all these legal,
terms
laws, all these legal intricacies, let's say. So we got the license, we came back happily, we opened our shop, we didn't know that. But I even haven't seen who SR Chowdhury is. Not even in my dream. Only now I am coming to realize that I have to produce that certificate also.
See, that may not be the same case in every person. A lot of not like I'm gonna guess you a lot of guess a lot of will be a man get to any to criteria to fulfill like a man driving license on a wiki, but be residential, permanent residential certificate, no NOC and be one is not. So those are the record documents you bring going up this to some question. So will be at that time, without pharmacies cannot be run. Clear cut from the day one. Takantra koi disi gule. Amo kandi we could have go for another option. Pharmacy run gula chance na moi. Koi na itu din bra mo so professionally choose ko para. Will be itu la to mangi pona. I want to just to fulfill the criteria ekta ami ko ani dise fulfill hoise amon ki authorize dise pharmacy gule gula. Mola namte ase pharmacy bi. To thik ase guri thaka dinte 20 years upper run gura pichite itu 20 years ko to ni no renew guri every 4 years renew guri gina ahi ase. To renew grant to Kohima. Next year, open the bone over there. Good precaution over there. Kuri the last day. Kunba to 30 years run grabbish, 25 years run grabbish. Abuni the qualified no I go to kiss.
Latest renewal to it was a day. Last year, January the latest. Itu department ma renew gurilaga se. Amiga marana hoi. Itu bi ase de. Itu department itu ka takani issue gura se. Oye, first pale tu tahan mohan na jani libi tahan tu jani asu tu. To ini ka hojo kule tu renew gura time ta apni kan tu ini ka na hobo de boli tu hoshi to. Last year tabi na itu bi issue gura se tu itabi na. To issue gura se aru bong gura se. To ami kan bi na jani hoshi. Itu kan answer to department he answer kuri level. Ami kan di na jani itu kan to.
Taikan 2020 de time to time then la kiba to change kuri de time la stance to change kuri de kunuba dem di kwese then 2020 ba disi when stick kuri ase then kunuba dem di kwese 2020 de newspaper de through newspaper then publish kuri se but because of covid we then udula issue to less sideline granai par rakhi thakise ina way ase bolibi moan lo de personally ina una ahia do le 2021 September ra
21 September day dile ablan ita to koki
na idwa moan bi paria ta kan do appoint gure ase do
Manu he na thagya bra ko to bra ni guna. Kiman pase iman tu pura se na. Holibi manu he na thagya bra mi kan bi itu the answer dikini ka ko.
Logic to key as pharmacies to 9. No pharmacies cannot be run without pharmacies question. Only they are still issuing the license till 2024. Aru DS to if I am 100 na paina se poila la issue video hanbi debe na paina se aru kile notun DS to itu in proportionate as to itu balance aina dibo lagi to pharmacies lagi kule pharmacies kiman ase Nagaland de takhana report ase registered pharmacy because they didn't allow from outside state out of the state, so it is very much in their record. So they should know how many pharmacies are vacant. Na kiman pharmacies fill kuru parebo. It is only nine takan bi license bi dibo lagi to. Only be number of drugs license issue brought to do. They figure to 1,157 ase. Only be actual lukai na board poya bisi ase debe. Ko ai sabti to 3-4,000 license bi issue brought niki. Kuna sabti to dia man to na le. Ini ka ase. Only be can run brought to 1,000 class run ko ase. So itu TV among we are running sort of these pharmacies, qualified pharmacies.
Itu kan laga actual number kan jani bo nimite ami kan kiman issue kuri dije. Itu kan actual number jani bo nimite on the 1st of May this year. Ami kan itu letter kan bi department ke dije. Itu kan answer mo hangi dibi. Na. Itu kan bi dianai do itebi mo hangi. Abni hambi sabo gole tu mo hambi ase do he. Ami kan itu kan so ba ai na mo han lo de ase.
We have put around 11 questions. They have answered so far only 2 questions.
So when did you put up this RTI?
1st May. Edura aje de condition abni kan lagila ami kan lote na liso pasede itu kum kam de jaise kum khalia se kum muri se kum badu mohan jania se de ini ala bi thakibo ole bi condition ami kan itu khan ge kwa dole to ami khan bi inika je itu karne ekta understand gune kotha kurile beshi bal hobo inika para department gi ko bole ma
So when did the government, the department actually ban pharmacies from outside the state to work here?
it was only last week only verbally said to us
work no
Yes.
license to law na diole la azula anule confuse hole.
itu pharmacies to bahar bara ani bole na kilo mane pharmacies to
Certificate na?
or certificate to bahar bara ania to verbally it was talked to us last week only that you cannot bring any certificate from outside earlier it says that you can bring NOC only be it be bonus de itu kan na hobo apni kan itu apply kore dele na hobo
Actually, na system do na today, Nick. For more clarity, pharmacy license to Twitter system ase. Ekta ase ido technical person. To qualified pharmacist usually he will apply for the license directly in his name. That is technical person there. Alag to a firm ase. Firm means anyone can apply for a pharmacy license, but he or she has to appoint a registered pharmacist. So when la namdi khulina je, we have the right to get a license. Holy we point in question do le udo registered pharmacist to manage the pharmacy.
That RS Chaudhary ka certificate that you have,
Yeah.
it was given to you by the department.
Yeah, it was given by the department only.
many of the license holder do not know who is the pharmacist it was given by the department only that's why we don't know only department have to be answered those
Acha.
Apply kore dibi kobo na.
babu apni kan bhi apply korile pabo
Do you have any further question?
Name of the qualified person, the name of the qualified person written in the drug license. We don't know who the person is.
That's what.
This was filled by the department only.
So have you ever asked the department who it is or?
No.
Some
Because we don't know the
some
person
pharmacy
who the
owner
person is.
kumadu jena hudida. Tomani jur find out kuru boido. To kudu bisaru. Takan brai dishe na. Kudu bisaru boido. Qualified pharmacist to kunas. Kudu thagi kud kina bisaru. Naga asda.
They doesn't clarify us also that you must know the person. Blindly they have given this thing.
So, minimum, how do they charge range? Can you just-
Kumbadu only do 10,000. Actually, it is only 3,000, somewhere 3,200 only na. Only be ki goes. So logo de kumbadu 30,000, 40,000, 50,000, 60,000 tab be charge kore bi asu
Annually?
No.
just per license. Ini. So iniga ujase to tahan lama jo de second person, third person thagyo pare mohandu najane. Like we said earlier, we applied to mohandu imam mangije dije mola license paise dokan julias. It was
So are there any instances of, the same pharmacist being named in 2-3 certificates, 2-3 licenses?
That is what we heard.
that is
Yeah,
what
yeah,
yes,
That is what we heard.
Hi, Chandu.
we heard. Anyway, thank you so much.
No. In conclusion, I'd like to say something. Okay, please. Now, as per the law, it is mandatory on the part of a pharmacy to appoint a registered pharmacist. We understand that. When it comes to that law, we are at fault. The reason I have said before. Department has resorted to many, well, what term you call it or what term they call it, let them use the term, but they have resorted, they have stepped out of the boundary. But we are not accusing the department, okay? We are not trying to find fault with the department. We are not accusing them because that is not the solution. But ANPA is of the view that only the general public will suffer. So we appeal to the department to come out with some sort of solution so that at least the transition to a better Nagaland will be smooth. Now, Thank you all the media persons for your patient hearing. Thank you so much.